someone asked me, responding to my video, one of the videos about AI, what is the way to learn how to use AI? I gave an answer, but it may be too complex. It was a case of what I did for the 6 months I worked with AI. And it's still a progressing situation, which I would come back and repeat and revisit this. But in this video, what I want to share is the basic attitude of how to solve problem using AI, but it applies to how we use our mind, which is always a big topic for me to do my YouTube, connecting to our heart. Here is a case, let me see if I can share with you, of how I processed the problem solving. And the case is about my finger joint showing a sign of arthritis. What can be done? That was my first question. I have some vague idea, but I just want to throw out the big questions like that to see what they say. And I'm not going to read all detail, but I can post this in the description. The Gemini in this case talked about common signs of arthritis in finger joints and what can be done: medical consultation, lifestyle modification and self-care, and the physical occupational therapy, hand exercises, supplements, what to see, when to see a doctor, and that's too long. So I picked up 3 areas. So I kind of put in the quotation, one of the items, it might be worse in the morning. And I said spot on. So this is like I'm giving a feedback to certain key issues that I find interesting. So that's one item. And Gemini talked about the stiffness. And I said not too bad. And the swelling, it's not obvious. That's my response. But I don't describe in a long sentence. I just say what they said and how I feel, what they said, how I feel. And the 4th one is bumps or deformities. I said, pinkies for several years. I am 77, and so forth. Well, there are many more actually. Topical medication I have not used, but I take omega-3, things like that. So I'm giving the general feedback of my current situation, because prior to that was the generic idea of what this is about and how to deal with it. But I want to nail it to the specifics that I can do. So to get there, I gave the certain symptoms that I thought highlight my situation. So Gemini responded that it's good that you're actively managing and incorporating some practice like omega-3, turmeric. Given your age, it may be like osteoarthritis, OA, often referred to as a wear and tear arthritis. And he says, let's dive in some of your points. So out of the few points I said, he picked up and responded, which is the way I like, and I'm happy that he did. And I responded, increased blood circulation. This sounds like a great idea. That's what I said in the previous response. So Gemini expanded that there's a way to increase like warm socks, a daily warm sock for 10 minutes, warm paraffin wax bath, gentle massage. The second point, I do hands open and close and use a rubber ball to squeeze. I may do this too much. That was my response. And that they said, this is a very astute observation. Gentle movement is crucial, but avoid doing exercises. So listen to your body. Focus on smooth, controlled movement, frequency versus intensity. Vary your routine. The other item was turmeric. I said, not a large dose, please make suggestion. So that item, they responded, dosage can be so and so, and the quality should be so and so. Things of that nature will give me more understanding. So after that one, I focused on the curcumin because I'm not as familiar about the curcumin. So how much are there in turmeric? Because I take, and also I do take black pepper, but very small. Please give me an idea. So I get more specific question to what I do, understand what the curcumin is and how much may I take. And Gemini says, you're asking excellent questions about getting the most out of your supplements. So Gemini start to get better understanding of my situation, so their response get more focused. So curcumin versus turmeric, how much in turmeric? So turmeric is a spice, Curcumin is a primary active compound within turmeric, The amount of curcumin in low turmeric can vary significantly, but it's not a huge amount. So they're saying something more to be considered on that curcumin. And black pepper for absorption, how much was my question. And Gemini answers, you're right to focus on black pepper. Its active compound piperine is crucial for significantly enhancing the bioavailability of curcumin. Without piperine, a large portion of the curcumin you consume is quickly metabolized and eliminated by your liver. So there's some issue of combining black pepper, which I take or use it. But again, it depends on the amount and the combination of those. So I'm asking, how about just taking turmeric and black pepper and things like that? So they gave me a summary recommendation afterward. And then I go to the next level, but I don't need to go through this. So that basically was probably 15 minutes, 10 minutes, 15 minutes conversation back and forth. So I got the idea. So that's how you use the Gemini related to potential problem with arthritis, which is not a big issue, but for some reason I thought about it because I felt a little bit of a stiffness, but it may be also related to the morning situation that he says that can happen when you are up in the morning. Maybe the circulation is related to that. So what I'm saying is that you are to have a curious mind and ask the question. and keep on focusing the area that is important. And to do that, you cannot just ask big question and get the big answer because it's too broad. You need to be specific to explain your circumstance and find the solution. And of course they say go see the doctor, but I'm a lazy person. I mentioned that to them. So I try to make the most of what I have in that 10-15 minutes. So that's a issue of curiosity. If it's important and if there's a will to keep digging in, you get the answer. But if you don't, you may just stop before you get to the specific answer, and you may try this or that, but that might not fit to your case. So AI can be very powerful, but that power may not be realized unless we ask the right questions. So this is a very broad view of how to use AI, and the other approach I explained elsewhere is more complex and difficult, but it's basically going through stop and think, or my usual explanation to describe this process is to go one step at a time and use this CAPD, check, act, plan, do. First, check what's going on. Out of that, come up with a question, overall broad question. Check, act, plan, so that's the plan, and you act on it, and then get the result. And seeing the result, okay, I don't need to talk about this, or I want to focus on this, my symptom is this. So you nail it into the next level of the specific question. And when a specific question you have, and when you ask the question, you don't have to explain in many sentences, but just like copying what they said and my response, and copying what they said and my response. Very quick, because they can figure out what I'm doing by just giving the corresponding answer related to what they said. So if you have the list of those going on, and the AI would then incorporate all of that and process it to the next level of a specific answer to that. So going through this, in this case, maybe 2 or 3 steps, I could nail it to understand the nature of the potential cure and the potential way of checking into the future. So one thing you want to talk about, and maybe I can share this in the next video or other video, is you want to have these things to be acted upon. And for that, you need to have some organized way. So it's this continuation of CAPD, check, act, plan, do. Some people say plan, do, check, act, but I don't want to plan without knowing the specifics. So the reality that I have as the cause of the problem has to be made clear, and let them lead you to get to the solution. And when it's done, maybe in the next video, I can talk about how to organize the information you get and how to develop a plan, and also keep this in the record like a Google Doc, so that you can orchestrate not just this issue of arthritis, but there could be a bunch of other things to use AI. So it's like a multiple project you have, and multiple answers, multiple specific informations there, but you need to have some organized way of managing those. And it's your responsibility, our responsibility, to manage our life. So don't depend too much on what they say, but nail it so that you get clear picture or what to do, why, and how, when, all of that. Thank you. I hope that clarifies a step going forward.